Research Center welcomes everyone to guest talk KAPS exam and its guidelines by Alumni Committee in association with the Training and Placement Cell, Yenepoya Pharmacy College and Research Center, Yenepoya Deemed to be University, Mangaluru, Karnataka. A very warm welcome and delightful morning to our speaker, Dr. Akram Ahmad. Welcome you, sir. Also, I welcome Dr. Mohammad Gulzar Ahmad, Dean and Principal, YPCRC. Welcome you, sir. International Scholarship in June 2017 from Government of Australia and the University of Sydney to support students of exceptional research potential with their studies. He is a founder and CEO of Academically. It was founded with a single goal in mind. The goal was to help qualified healthcare professionals across the globe in achieving their passions and dreams by educating and training them to acquire the necessary skills and competencies to register themselves as a certified healthcare professional worldwide. Dr. Akram Ahmad is going to give a talk on the KAPS exam and its guidelines. Over to you, sir.
Akram sir, yes. Am I audible, sir?
Yes, sir. Yes. Can I start?
Yes, sir. Please, sir.
Are you guys able to see my screen? Full screen?
Yes, sir.
Okay. So hi everyone, this is Dr. Akram here from Sydney, Australia, and today we are going to discuss regarding the opportunities for you in Australia and New Zealand. Okay. So and it's this webinar. So if you have any questions, you can ask me. And thank you, Saurabh, for arranging this session again. I think last year I have given one talk in your college earlier also. So today is basically for you the opportunities. Okay, right? So if you have any doubt or any questions, so please ask, or maybe you can just type in our chat box. Maybe Saurabh can ask directly, or maybe if they can provide you the mic, so you can directly can ask me or interact with me if you have any questions. So we are basically a Australian edtech company, and we provide the assistance for all healthcare professionals like medical doctors, dentists, pharmacists, nurses, lab technicians, physiotherapists, optometrists, veterinary doctors. So any healthcare professional looking to migrate in abroad, so they need to complete some steps like, for example, first step document verification. Then they need to write the exam. Some country allowed to write the exam in India. Some might be you need to go to the particular country, for example, US for an like NAPLAX. Okay, so academically will help to prepare yourself to complete the process so easily you can migrate with your family. So this is a little bit about me. I think she already given me regarding my intro. So I'm an Indian pharmacist. Completed my diploma in pharmacy from Karnataka itself, and then Bachelor of Pharmacy and PharmD PB. And I did my PhD from University of Sydney. And I have around 10 years of teaching experience for pharmacy practice and clinical pharmacy in India, and around 4 years in Malaysia. And last 6 years I'm here in Australia. So in India I worked just for a few months, 3 to 4 months, and then I moved to Malaysia. And last 6 years I'm in Australia. So I have around a lot of work I did in pharmacy practice field, so I can understand your pain basically. So you are in final year student and always you're complaining that there is a not good scope in India for pharmacy, but in abroad definitely there is a very good scope for you. So Australia one of the best country I can say. You can move in 2024 2025, and lot of visa government is giving, lot of jobs are available, salary also is very high. So we'll discuss on all those things. So academically basically provide the two services. One is the study abroad. If you want to study in Australia, we can help you in your admission process. But this is very expensive process. You have to pay the fees for 2 years, whether you want to do any MS degree or, for example, like Master of Public Health, Healthcare Management, or Informatics, even Medical Biotechnology. Master of Pharmacy. So there's so many courses, and but the fees very high. So for Australia, basically, we can migrate to Australia as a pharmacist, as a retail pharmacist or hospital pharmacist. In Australia, does not require to have any work experience. So if you have a zero work experience and you are just in final year student, is still you can migrate to Australia. Okay. For retail pharmacist, hospital pharmacist does not require to have any work experience. So these are the three steps you need to complete in order to migrate to Australia. The first step, initial skill assessment with APC, Australian Pharmacy Council. So this step we will complete behalf of you. So you just need to provide us a document. Okay, so this is the step one process. Next, you need to write this KAPS exam. Okay, knowledge assessment of pharmaceutical sciences. This is really very easy exam. If we compare in our GPAT or NIPER J or any other university individual exam. For example, Manipal also conduct on exam, KL University also conduct the exam, or there are so many Yenepoya also might be taking the on exam, right? So if we compare this exam, this is easier than those exams. And you just need to score 50% marks and no negative marking in this. And then you also need to pass like English test. Okay. So like IELTS, OET or PT, so we will provide you the coaching for this as well. So step one we will complete, and step two will provide you the coaching for 4 months from Australia. So we have our mobile application, and you can see we have our LMS, learning management system. So you can use on laptop or whatever system you have, an iPad, laptop, mobile phone, wherever you can access. Okay. So then we'll provide you for English also. So once you pass these three steps, then easily you can migrate to Australia as a pharmacist. So this is for same for hospital pharmacist and retail pharmacist. So these two occupations have the same job description. So once you registered as a pharmacist in Australia, so you can work in retail pharmacy, or you also can work in the hospital pharmacy, clinical pharmacy, consultant pharmacist, you can work. So industrial pharmacist is someone completed like bachelor degree or master degree. Now they want to work in pharmaceutical industry. So those already have a 2 year work experience in manufacturing side or QA/QC and an FND. So in that case, you can migrate Australia as an industry pharmacist. Okay, but need 2 year work experience. Same for technician, need 1 year experience. Technician also you can migrate as technician as a one year experience required. So in Australia, very low number of colleges available for pharmacy. So university lecturer basically very, I can say, no or low number of opportunities available for in the academics. That's why they need around 3,000 pharmacists yearly from abroad, or foreign pharmacists. They give the visa for them. Okay, so the Australia and New Zealand have the same steps you need to complete in order to migrate to Australia and New Zealand. But you need to decide where you want to migrate. So if you want to migrate New Zealand, then you have to start your process with New Zealand Pharmacy Council. Or if you want to migrate to Australia, then you have to start your process with Australian Pharmacy Council. Okay, this is the difference. And there are also some difference, especially in the Australia does not require any work experience, as I mentioned earlier, but New Zealand require at least 1 year work experience in retail pharmacy or hospital pharmacy. So you must have at least 1 year working experience in retail pharmacy or hospital pharmacy. Then only you can start your process for New Zealand. But Australia does not require any work experience, and Australia provides multiple attempts to attend this exam, but New Zealand gave only 2 attempts. And New Zealand is a very small country. The opportunity is not that much high, but as compared to Australia, a very big country, a lot of opportunities here. So recommendation for you to migrate to Australia instead of New Zealand. but we provide assistance for both countries. So wherever you want, we can help you. So skill assessment, we need, these are some of the documents like your degree and transcript, registration we need, and passport, national ID like Aadhaar card, birth certificate, passport photo, all these documents required. And you need to pay the fees directly to the Australian Pharmacy Council or Government of Australia. You have to pay for them 1310 Australian dollar. In it's about basically in Indian rupees 65 to 70,000 Indian rupees. Okay, around 70,000. So this is the University of Sydney. So if you can see, the buildings is very old. So this is one of the oldest university in Australia, or I can say worldwide. So they established in 1849 this university. So the first school they established is called Sydney Medical School. Okay, and then later on the school grow, and then they start pharmacy school also, the School of Pharmacy, Sydney Pharmacy School. It is in an 1899. Okay, this is one of the very old school in pharmacy education, especially in the healthcare or medical education. So the building somewhere here behind this, and that's the pharmacy school where I did my PhD and where I also work as a pharmacy lecturer there. So this is the KAPS exam. So you need to write this exam, knowledge assessment, pharmaceutical sciences, and the fees you need to pay 2230 Australian dollars. And first of all, for this exam, no negative marking. Okay, it means you need to attend all 100 questions, and the passing marks required only 50%. So there is a two papers you need to write in the same day. For example, uh, you are going in the morning, maybe 9 to 11. There is w- one paper, and then you need to there's a 1 hour gap, and then you have to go for the paper two. So paper one is, there is 100 multiple choice questions, and they will ask you around 30% questions from pharmaceutical chemistry and 70% from pharmacology and physiology. Okay, so 70% from pharmacology, physiology, and 30% basically on the chemistry part. So you have to score individually 50%. For example, if they ask 30 questions from chemistry, so you have to correct 15 questions, 1 5, to pass this exam. And same for if they ask 70 questions from pharmacology or physiology, so 35 you need to correct in order to pass the exam. So same for paper two. So these are the four domains. Basically, they will ask the questions like domain one, pharmaceutics, pharmacotherapy, pharmaceutical chemistry, then pharmacology and physiology. These are the four main domains for to pass this exam. They will not ask any questions from like pharmacognosy, as you study a lot of semesters in India. In chemistry also, they will not ask you like very in depth like SAR, all those things. They'll ask very basic structured things, and yeah, very easy question they will ask, like conceptual questions in generally they will ask. So once you give this exam, after 2 to 3 weeks, you need to will receive this result, and this APC, Australian Pharmacy Council, will send you an email. Just here, yes, you pass the exam, and in this exam, the passing marks require 50%. So in the result, they did not mention that how much your score, like you score 90%, 80% your score, or just 50%. They will only mention that fail or pass. So it doesn't matter whether that whatever you score. You just need to pass this exam, okay? And they will give you a letter, and based on that letter, you have to start looking a job and start finding a I mean, if you start apply the visa and after start looking a job also. So these are the exam centers currently in India, like Delhi, Noida, Gurgaon, Pune, Mumbai, then Bangalore, Hyderabad, Chennai. These are the 8 exam centers in India, and this exam going to conduct in yearly 3 times: March, July, and November. Okay. So there is some news from academically. 90% students pass from academically in their first attempt. Uh, so in English, basically, you need to go for academic one. IELTS academic or PT academic, you need to go, or OET also you can go. So this TOEFL is not accepted in Australia anymore from 1st of September. So this is the old, basically my slides. So these three tests are eligible for Australia. So anyone you can give. You can give IELTS, you can give or PT or OET or PT or IELTS, any test you can give. And we need 7 individual band in IELTS, 7, or B basically in OET, B or 65 we need in the IELTS. Okay. If someone have 2 year work experience, then we can help as industry pharmacist I mentioned. And for technician need 1 year experience. So since you are in school, so I'm assuming that you don't have any experience. So once you pass the exam in English, then you are eligible to apply this PR visa like 190 and 491 and 407. These are three visa does not require any work experience. These two visa is a work visa. They required work experience. So I do not recommend to anyone on come work visa. Mostly you have to come on PR visa like 491 190. You will get definitely once you pass the exam. So first job you have to work as an intern pharmacist for 1 year, and you will get the salary around $30 per hour. Okay, and for 1 year, and then you once you become a pharmacist, then you can work in community pharmacy, hospital pharmacy, and some might be you are here for pharmd students or maybe I'm from pharmacy practice. So they always ask me this question that how we can become a clinical pharmacist in Australia. To become a clinical pharmacist in Australia, so you need to pass KAPS exam and become a pharmacist in Australia. And once you pass this exam, then you have to go for SHPA, Society of Hospital Pharmacists of Australia, and they will provide separate training. And there is a exam, and if you pass this exam, then you can become a clinical pharmacist or consultant pharmacist in Australia. So for this to become this is like a part-time thing. You have to work full time, and evening time 1 or 2 hours you just give for one or 2 months and pass this exam. It's kind of certificate. For example, if I have our like your state pharmacy council start any course, or maybe Pharmacy Council of India started some course. So this is similar kind of the association here in Australia. So SHPA, and then you can become a clinical pharmacist here. So average salary in Australia around 3 to 5 lakh per month as a pharmacist, and average time will take around 6 months to 1 year. So there are some of the reviews from and academically. So Abdul is coordinating with you guys. So please contact him on this number if you have any questions. He will happy to answer all of your questions. Or you can also contact to Amin. He is our manager. Okay. If Abdul is not responding, or if you have any problem, so directly you can reach to Amin. He is the head for India. And you also can email us on this website, and you can just visit us on our website. And also highly recommended for you guys. So go to my YouTube channel. So you will find a lot of information, new information I always uploaded. Recently, I uploaded one video that how you can become a pharmacist in Korea. Okay. So many students always ask me in the questions based on your questions. So I always make the new content. There is the opportunity for pharmacists. So this is my channel. So you can subscribe and you will find a lot of different videos. And yes, we are providing basically loan facilities. So you can pay the fees in 3 months, 9 months, 6 months, 9 months, 12 months without paying any interest. So this is an interest-free loan. Okay. This is also video regarding this. So just 2 days back, I uploaded this video for Korea, 3 days back. And this is like Queensland, the visa opening in Australia. So you will find a lot of new information here. This is the student from academically pass after 20 years of study gap. We recently joined us. And this is also from Mumbai. He passed this exam. This guy also. This is a all these are basically a lot of stories from our own students. They passed with us. So they passed the exam. Now they are in Australia. This is the Cjo Matthew. He just got the visa in 3 days back. So he just informed me that he got the visa. My visa granted. Thank you, sir. So he just got this visa on Thursday only. Okay. So last week only he got the visa. And another girl, she's in home country only, but she got the visa, the job, internship. She's in home country and she got the job. Yes. He's saying the good morning, Dr. G. Vanida got, this is basically, Vanida Batta is our student and this is Sukrit, her husband. So he just informed me that she got the job offer on and they are coming to October. October. So when I asked when they are coming, so they told that 8 October they are coming to Australia, and before they come to Australia, they got this job. Okay. Then I asked them to come to visit me. Then they think 100% they will visit because they passed the exam, they got the visa, they got the job because of academically. So this is the pharmacy name where she got this job, and this much the salary she got. First 6 months they will pay around $28, and after that they will around $1 they will increase. So a lot of students basically, they are passing from academically and they're getting the jobs. So now we can talk one on one. If you have any questions? Yes, Saurabh sir.
Yes, sir. Am I audible?
Yes, yes, Saurabh.
So, sir, basically, today we have with us our B-Farm students, as you have focused on the B-Farm and M-Farm. We also have our D-Pharmacy students with us, and they are in the final year. So, do you have any suggestions like how they can become pharmacists in Australia, or whether they should only go for D-Pharmacy and then MD?
Okay, okay. So basically, if you are a B Form student, right, B for M Form, and diploma is totally different things. Okay, so diploma basically worldwide they consider as the assistant pharmacist or pharmacy technician. Okay, so in Australia they can work as a technician or assistant pharmacist. They cannot become a pharmacist in Australia. Okay, same for if you want looking for Dubai also. Uh, you can become basically the technician there or assistant pharmacist. Same like this. Diploma holders cannot become a pharmacist. They can become a pharmacy technician, but they must have at least 1 year working experience. So since you are in final year, so my advice to you to at least work for 1 year in any retail pharmacy or in any hospital pharmacy, and simultaneously you can prepare yourself for English like IELTS, OET or PT, any test. Then you can apply for pharmacy technician. So we also help for technician to apply. Okay. Now is the Bachelor of Pharmacy or M.Pharm is here. So lot of opportunities basically for B.Pharm because except 3 countries worldwide you can migrate basically. The US they required PharmD and Ireland required PharmD and now Saudi Arabia also required PharmD or M.Pharm, not B.Pharm. So Saudi Arabia also required 5 year minimum bachelor degree. Same for Ireland, same for US. But apart from this, you can migrate to Australia, New Zealand, Canada. We also basically provide assistance for Canada also. So if you all, but when you are thinking to migrate to any country, so you have to basically have very 3 basic questions from yourself. First question that which country is the easiest you can migrate in the sense that you can get the visa. For example, getting a visa for US is very very difficult, nearly impossible. Okay, so even if you pass the exams, it's very difficult to. Otherwise, you have to go there and study there for MS, and then you can pass that NAPLAC and become pharmacist. That's totally different story. But here, so very Australia is a very very easy exam because just you need to score 50%. So easily you can pass exam. An exam center in India itself, so very easy for you to pass the exam, right? And secondly, the government of Australia given around 190,000 visa, PR visa, permanent visa. So you can migrate Australia permanently. So you are not coming like temporary. So if you are going to work in Dubai, Saudi Arabia, Kuwait, in these Middle East countries, so Middle East countries only provide the work visa only for 2 years. Then they might renew or they might not renew your visa. Okay, but Australia provides a permanent visa. Guys, those are online. I will talk to you one on one. I will just I'm just giving the answer here. So then I will talk interact with you with our online. So exam is very easy for Australia. Getting a visa is very Australia easy. Getting a job also very easy because a lot of pharmacists are vacancies are available in Australia. Okay, so I think for next 2 years, 2024, 2025, Australia is the best country I can see. The reason why Australia, if you follow, maybe when you still following, I don't know. Um, I make the content on last 5 years on YouTube. So earlier, like in 2020, before 20, I always said that Australia is a very difficult country. Yeah, because they are not issuing the visa. So what happened here? The government changed basically. So earlier, last 8 years, like last two terms, there was a government, and the government was very strict to give the visa. So now government is changed here, and now they are issuing a lot of visa for the pharmacists. They need pharmacists around 3,000 yearly. So if you can just pass the exam in your home country in Bangalore, just center, and easily you can match it to Australia.
So we have our alumni online. Saleh is there. Saleh, you can unmute yourself and can ask the question.
Good morning, sir.
Yes, Saleh.
Sir, where is the center for CAPS? Like, do we have to go to Australia and write, or can we write from India?
I already mentioned that Bangalore is the exam center. Bangalore, Chennai, Hyderabad, Mumbai, Pune, Delhi, Noida, Gurgaon. 8 exam centers. So you just need to attend this exam in India itself.
Okay, and can you just tell me, like, what is the overall expense, like, after B Farm, if we are planning to migrate to Australia? Like,
Yes. So
uh,
this is very common question. A student asks is how much money you need to invest to migrate to Australia in general, basically. So around 70% fees you are paying directly to the government of Australia, not paying to us. Okay, you are paying only for us for our course, what we are providing for you for the 4 months. Okay, like skill assessment, you need to pay 1310 Australian dollar. Then when you are booking your exam, then you need to pay 2230 Australian dollar again. And when you want to write this maybe the IELTS or OET or PT, then you again need to pay the fees. And for visa you also need to pay for $4,200. So altogether including our fees, so it's maximum 6 lakh Indian rupees, around I mean just I'm calculating at 12,000, 10 to 12,000 Australian dollar. Okay, and you no need to pay all together this fees, because this is like a step by step process. First you just need to pay around 70,000 Indian rupees for skill assessment, and it may take around 2 months to complete that process. Then you have to book the exam after 3 months. Okay, then you have to pay that 2230 exam fees and sit in the exam and pass the exam. Then after 2 months, then you have to apply for visa 2 3 months. Then you need to pay the fee. So basically, you are paying in the installment this fee. So total time basically it may take around 6 months to 1 year. So this money, whatever you are investing, like 5 to 6 lakh, you have to pay during this time.
okay, sir, thank you.
Thank you.
Thank you, sir. So there is a common question from the student side actually. There is a
Yes.
common question from the student side. As most of the students belongs from India, so they have a common question whether their degree is valid in Australia or not in other
Yes,
countries.
100%. There is no doubt. So even some student did like diploma in pharmacy, then little entry bachelor of pharmacy. I don't know, is there any student like this? This is also eligible. And any basically bachelor of pharmacy PCI approved college in India. This is approved degree in Australia as well. So basically what they do, they will check two important things. They will check which university you are graduate. For example, Yenepoya. So they will check that in UGC website, this university is approved by UGC or not. Obviously, in India, all the universities are approved by UGC, right? And secondly, they will check this the Pharmacy Council of India, they approve this college or not. Obviously, I mean, mostly college 99% they are approved by in the PCI, right? So your college is approved. So No need to worry, basically, So all the colleges in India, I never face any problem. We have more than 1,000 students so far. We help, and 90% students from India only. To pass this exam, so we help them. So no need to worry. Your degree is valid, basically. Yes, Salman.
So I have one another question.
Yes, go on.
So after M.Pharm in pharmacy practice, like is PharmD better or M.Pharm in, like, is it the same?
Actually, even if you are a PhD holder also, so they will count as the same. So that doesn't matter. Basically, you are a bachelor degree holder or master degree holder of PharmD, PB or PhD. Okay, so you have to go with the same process, and there is no even advantage basically to become a pharmacist. But obviously, if you are looking to market, like if you want to do some research job or academics, in that case, M.Pharm, PhD, you can go. Otherwise, after B.Pharm, you just can migrate to Australia. I mean, any country. So there is no advantage. So basically, the problem in India, we are not getting the jobs. Then we go for like M.Pharm, then we go like PharmD. So people think that if there is a higher degree, they will get the higher salary in India. But in Australia, this is not the case. Bachelor of Pharmacy is enough. You will get the same salary because here the government fix the salary for pharmacists. So pharmacist means the bachelor degree holder or master degree holder, they will pay the same. Now the difference while you are working. So how many years you have work experience and how you are working basically. So if you have very additional skills, the company is happy to definitely they will give you they will increase your salary. But not they will not increase your salary because you are a higher degree holder. And another important thing, I want to mention here. So you can do MD in Australia after a Bachelor of Pharmacy. So some of you are already here. So mostly students ask me this question that they want to do M.Pharm or PhD. So even you can become a doctor also in Australia after pharmacy. If you want to do MD, you can do in Australia MD. So the higher in Australia, basically, there are two medical degrees. After 12th, they provide 6 year MBBS, or someone did Bachelor of Science in healthcare degree, for example, like physiotherapy, nursing, pharmacy degree, or optometry, anyone. Now, if they want to become a doctor in Australia, so still they can become. So there is a 4 year degree for them, MD. So for you, if you can just pass the exam and come to Australia as a pharmacist, get your PR visa, and then you can, if you want to become a doctor, you can become a doctor in Australia as a MD doctor.
Sir, there is one more question from the student that whether we need to pay the exam fees for every attempts for the CAPS.
Yes, yes. If you fail, basically, then you need to pay the same fees, 2230 Australian dollar. But for example, if you pass in paper one and you fail in paper two, or you pass paper two or fail in paper one, okay, so you need to repeat the same paper only in which you failed. You no need to write both papers again. But the fees you need to pay the same because this is Australian government or Australian Pharmacy Council, they are connected the exam, right? So there is a center in Bangalore or Delhi, wherever. So they will charge the same fees from them, you know. So they will charge the same full fees to you again.
And sir, is there any validity after qualifying the exam? Suppose if today I qualify, then how many years I have?
Basically, in the sense validity, that there is a validity for 3 years. It means that within 3 years you need to come to Australia and start your internship. If you are not starting your internship within 3 years, then you need to write again this exam. But if you come within 3 years and start your internship, become a pharmacist, then this is like a regular routine work like in India. You need to renew your license, like your registration every 5 years in India or 3 years, whatever. Each state have their own law. So same here, every year you need to just renew the license.
And there is one more question, sir. After income or PhD, how many years required to apply for the job at Australia? And whether we can work in the Australia even after income or not? I think that answer or the response has been repeated.
No. This is basically, once you pass this KAPS exam, same day onwards, you are eligible to start looking a job. Academically will guide basically from day one. So, for example, there is an exam today is your CAPS exam, and the result going to come next 2 weeks, right? So once we know you are passed, then we will make one separate webinar myself, and then I will guide you for three important things. Like number one, you need to register with APRA as a pharmacist. How you can register their website, upload document, what the documents you need to collect, right? And second, we will guide you that how you can find a job in Australia. What are the website where you have to upload the CV. Basically, we will help you first of all your CV. CV as per the Australian standard must be, you have to change, and your cover letter we will help you. How to draft your cover letter whenever you are applying a job in Australia. Okay, and then what are the websites available in Australia? What are the agencies or consultancies helping to recruit pharmacists? We will also connect to you. All those things we will help. And secondly, we'll also help you for a visa, which visa you need to apply, when to apply, which website, this and that. So all the information we give to our honest all students once they pass the exam.
Sir. So there is one more question. Suppose if anyone is having more experience, suppose they are having some senior pharmacist or chief pharmacist in some Indian hospital, whether they also need to give the CAPS examination.
Yes, if someone is a PhD holder and he is working in AIMS Delhi, he is a chief pharmacist in Delhi, still he need to pass the same exam, and still he need to go for 1 year internship. The reason, they are not believing in your own system. They are believing their own system. You don't know anything about Australia, how to practice in Australia, how to communicate to a patient. Here is a very, very, the patient can see you, if anything happened to you, even if you are rude to him, lot of things basically Indian pharmacists need to learn before they become a independent pharmacist. So this 1 year internship they have to do under the supervision of a registered pharmacist in Australia. So this pharmacist is a mentor for this intern pharmacist. So he or she will guide him, in entire 1 year, how they can practice, in Australia effectively.
So there is one more question. Like, can you just summarize what are the job profiles? Like being as a pharmacist, as we know in India, they are mostly involved in the dispensing pharmacy. But whereas in the Australia, what are the job profiles?
Basically, in India, pharmacists not dispensing, they are not dispensing. In India, they are working in pharmacovigilance, clinical research, medical writing, medical coding, regulatory affairs. So maximum pharmacists working here and there. They are not doing pharmacist job in India. So pharmacist job means you need to work in hospital or in the clinical setting or in the hospital or in the retail pharmacy. Same here is the dispensing. You have to dispense the medicine, you give the counseling to a patient. Even you have to advise. So here is a very robust system basically. So if I go to a patient, sorry, I go to a doctor to see my doctor, and doctor give me a prescription, and this prescription already they will send to a pharmacy. So once I go to the pharmacy, he or she will read my this prescription, and he will ask me some questions. And if he or she feel, the pharmacist feel that is there any uh, something wrong in the dose or in the formulation, he or she immediately call to the doctor. And then you have to go to again to doctor and need to change. There is a lot of interventions from the pharmacist side in in the prescription, and same for in the clinical settings in hospital. So here's the role, very, very, I can say, responsibility is lot of on shoulders of the pharmacist. So pharmacist, and is not just a dispense in India. Basically, pharmacists, they are doing basically a business. Here this is not a business, here is basically a uh, service. Basically, I can say pharmacist doing a service to the patient. Here basically the system is, everything is free. Government is paying for doctor fees, government is paying for laboratory test fees, for access fees, even for medicine also. They are paying. So as a patient, I am not paying for anything. So they want competent people to work in the system. So you have to work in the retail pharmacy. In that, you have to give the counseling to a patient. Particular, there is a separate room for that counseling. Most of the pharmacies in Australia.
Yes, sir. We have Mr. Junaid. He's our alumni. Junaid, if you can hear me, you can unmute yourself and can ask the question. Really, the last question from this session. If anyone is having any other question.
Yes, Dinesh. Junaid, can you please unmute yourself?
Hi sir, I am Junaid. My doubt is my question is, if we are looking for masters in any of the Australian university, how can you help us?
I mean, I do not recommend to anyone to go for master degree in Australia. But someone want, then we can help. So you just need to pass English test and tell us which course you want, and we can connect you that university.
Okay, fine. Thank you, sir.
Basically, if you are coming to study in Australia, you need to pay 30 to 50 lakh Indian rupees. Okay.
Yeah.
So this is like a waste of money, in my opinion, because you only can start a job after 2 years once you complete your degree. Okay. And at that time might be, again, in academically more than 200 students, those are Indian students, they came to here to study. Within first semester, they join academically and they pass the exam, they got PR visa, then they discontinue their education. I have hundreds of students like this in academically.
Sir, isn't there any chance if we do masters, we'll get a more higher post?
No, no, nothing like this. As I mentioned, this is purely on based on your uh, skills, how you are performing in your job. This is not based on your degree.
Okay, thank you, sir.
Thank you. Basically, they just need a pharmacist. Whether you are a M.Pharm holder, PhD holder, as a patient, I don't care who's this pharmacist. And the pharmacy owner will also pay the same salary for him. But if you are doing something extra, you are a very competent pharmacist. So they might increase your salary. Obviously, if you have more work experience, they will increase your salary. But based on a degree, they will never increase your salary as a pharmacist in Australia. Yes, if you want to do like PhD, then obviously you can do M.Pharm and work in India for some years and do some research, publications, then try for PhD. In that way you can come.
Thank you, sir. Thank you so much for clearing our doubts. Now, I think there is no such queries from the student side. If there is any further queries, we'll convey those queries to you through Abdul sir, definitely.
Okay. Okay. Thank you.
Now it's time for vote of thanks. For that, I'd like to request Abdul sir from the Training and Placement Cell department. So, okay. Yes, I'd like to thanks for today's session, guest talk on KAPS examination. I'd like to thank for first and foremost to higher management and our beloved principal Dr. Muhammad Gulzar Ahmad and today's research person Dr. Akram Ahmad sir and the alumni committee and placement cell committee and to all our faculties as well as our alumni and BPharm, PharmD students and diploma students. So, sir has given a good information regarding the competitive exams for the job opportunities in Australia, all these countries. So, thank you once again, Canada. Thank you so much, sir.
Thank you. Thank you.
Thank you so much, sir. Have a good day.
Thank you, Sarat. Thank you. Bye.
Thank you, sir.